You're listening to Power Talk, Berkeley Electric Cooperative's official broadcast about the cooperative, our communities, and ways to use energy wisely. And now, let's join our hosts for today's episode. Good morning, everybody, and welcome to another edition of Power Talk. I am Micah Ponce, the communications guy here at Berkeley Electric Cooperative, one of your co-hosts for today's show. And I am joined by Miss Libby Roig, the Director of Marketing and Communications for the co-op. Good morning, Libby.
Good morning, Micah.
Well, we have a very special full house today. We have guests from the Shifa Clinic, Dr. Khan, and Brandon Kinney, the food pantry manager. Welcome, everybody.
Well, good morning, everybody, and thank you so much for having us here. We appreciate this opportunity.
Yeah, thank you so much for having us.
Oh, definitely. Well, you know, one of the things that we do besides giving you an official Power Talk mug when you come to the table is we want to find out a little bit about yourself, a little bit about your background, and I guess what brought you to the clinic. We'll start with you, Dr. Khan.
Sure. So I'm the founder of the clinic, and that's how the clinic started in 2012. I've been with the clinic for the last 11 years, and the reason we started the clinic is just based on faith, accountability, and the blessings that we all have received. And I feel, just like Jane says, that we cannot do all the good the world needs, but we certainly can do the good that we can do, small. Mm-hmm. Yeah. So that was the basis of foundation of the clinic, and that's how it started.
Okay. All right. Well, what about you, Brandon? What brought you to the Shifa Clinic?
I was working with the Red Cross, actually doing blood drive coordinations for the Charleston area, and was lucky enough to meet Dr. Khan and learned about the mission that they have here at the Shifa Clinic. Thought it was a great way to align myself with their values here, and it's been a great ride being here. So,
well, good.
Yeah.
Awesome. Good. So, Shifa Clinic. Okay, that you hire let me wrong. No. Sorry about that.
Well, no worries. Yeah,
we're so thrilled to have you guys on the show today. You know, we use Power Talk to certainly help spread information about the co-op and ways our members can engage with the cooperative or save money on their electric bill. But this is really just a delight for us to anytime we can have somebody from the community and just share our space and help get the word out about the good work that you guys are doing and tell people how they can help.
Thank you.
Yeah.
Well, you had mentioned, the mission of the Shifa Clinic is to provide, high quality medical care to those who are without insurance and to help prevent hunger in the community. Let's start with the medical side of the clinic. You have some comprehensive services and preventive care in a variety of specialties, including pediatrics, gynecology, prenatal, primary care, vision, and more, I'm sure.
Right.
So how do you provide those type of high quality services to the community for free?
Yeah, so a lot is depending on our partners that have the different organizations that contribute towards this organization. Most of them would be LabCorp, for example. LabCorp provides us with no-cost labs. Roper St. Francis provides us with comprehensive pathway for prenatal care. Direct Relief in AmeriCares provides us with medications at no cost to provide to the patient. DHEC provides us with the needed vaccines that are needed. Wow. There are volunteer providers who dedicate their time to see the patients. So and there are donors, there are community supporters, there are volunteers. That's how it makes the clinic run.
Okay.
Wow.
Well, I mean, how does somebody qualify and to receive those services?
So we have only two criteria. One is that the person has to be uninsured, and the number two, they have to be within 250% of the federal poverty line. So we do have an application process. Eligibility is checked, and they do have to support with the application with proof of income, ID, and a proof of residency. ID could be any ID. It could be their passport. It could be a state-issued ID from their country, any kind of ID. And the proof of income could also be varied, and we help with various forms of proof of income.
Okay.
What really resonated with me was, it's one thing to provide a free service to people in need, but these are really high quality care that you're providing in a beautiful clinic.
Yes.
Tell us a little bit more about your commitment to the high quality services that you provide.
Yes. So being a free clinic does not mean that we cut any corners. We have high quality standard of care. We follow what we need to do, and it took us a while. It took us a decade to be where we are, and it didn't happen overnight. And over the process, over the years, figured out what works, what doesn't work, and what can we do better. So every year, and even now, we are still trying. We're still trying to do our best and trying to improve each and every day.
Terrific. And you work with a variety of different doctors. Do they donate their time?
Yes. So all the volunteer providers are volunteers, except one who's on staff is a mid-level provider. She's Haley, who does primary care on Monday and Wednesdays, but all other days is through volunteer provider, including myself.
That's terrific.
We're talking about the medical side of things, but, as I recently learned, food insecurity is definitely a problem in our area. So the Shifa Clinic offers services to prevent hunger and support people in the Lowcountry who are experiencing that food insecurity. As a matter of fact, I just was part of a food pantry distribution where, and I actually learned to my surprise that apparently in Berkeley County, and at least in this area, we're considered a food desert, which is, doesn't have easy access to high quality fruits and vegetables for, reasonable prices. Even right here in my own backyard, I was surprised to learn that there are a lot of folks who are struggling with that type of stuff. Brandon, I believe you're the food pantry manager. Why don't you give us a little bit of a rundown on some of the services that y'all provide on that side of it?
Absolutely, yeah. So the Shifa Clinic offers a variety of different options here in terms to combat food insecurity. One of our main ones is the food pantry that we actually have on site. So we see many families and individuals come in on a daily basis looking to pick up a box of non-perishable items, meat, dairy, fresh produce, as you were talking about, that they can have for themselves and for their family as well. Also, we have Amazon food delivery services that we have that is an option that we have for families that aren't able to get to the clinic, or if somebody doesn't have transportation or reliable transportation to make it there. We have a mobile food pantry service where we go out and about, find individuals to, maybe that it's a homeless population or those that we can actually reach out and provide them with not only food but hygiene kits as well. And then also a child hunger prevention program that we work with. So we work with schools to provide kits for children to be able to bring home food on the weekends and stuff like that. So it's just a lot of options that we offer to really combat that food insecurity that you were discussing. Yeah,
I mean, I know one of the things that we had discussed, as you mentioned, having the mobile transportation part of it is extremely important because when I was talking with organizations I was working with, they were saying that, a lot of folks do not have the ability to come to a drop-off location or come to you. So having those delivery services or our outreach areas are extremely important because, if you're living 45 minutes away, and you're in need of these services, more than likely it's going to be difficult for you to be able to find a way to make your way there. So I think that's a very important part of the entire food service. Yeah,
and at this point, I would like to give a shout out to Amazon.
There you go.
Because we could not have done it without Amazon.
Wow.
Yes. They provide their staff, which are volunteers for us, and they dedicatedly deliver the food to close to, I would say, 300 families a month.
Wow.
So it's a whole system that is followed between Amazon and us to make sure that home deliveries are done adequately.
Wow. So did you all reach out to Amazon for the partnership?
No, actually it was Amazon who reached out to us, and they came through Lowcountry Food Bank.
Okay.
So, and our partnership is now for almost 2 years, and it's flourishing.
Wow, that's terrific.
So about 300 people or so a month for the food part of it?
No, that's just for just for the home deliveries.
Just for the home deliveries.
But our pickups on a monthly basis, including everything, ranges from 800 to 1,000. A month.
Right.
A month. And then for the medical visits, we have close to 400 medical visits a month.
So, it's been a rough few years for all of us with the COVID-19 pandemic and all the disruptions that have happened, between learning in the schools and the workforce. Are you guys seeing an increase in need, or has it been about stable? Or?
Pretty much a slight increase, and I think after the SNAP benefits have been decreased, that has been a further increase in the food pantry. We've seen more increase in the food pantry as compared to the clinic section, but of course clinic is also there. But yes, definitely an increase.
And it just, the cost of everything has gone up
yes,
over the last.
The inflation has added to it.
Yeah,
right.
so, you might have, working parents who are doing the best to raise their family who just can't make ends meet.
Absolutely.
It's
Absolutely.
not that they're irresponsible or anything.
That's absolutely right.
Yeah, we had a guest on earlier this month who she doing a lot for folks in the community, and she was mentioning the homelessness population. I mean, in terms of homelessness, it might not be because you're irresponsible with your money. Changes in the economy have a major part to play in that, especially if you're only receiving Social Security, and then the next thing you know, the price of all the food goes up.
Yes.
Prescriptions.
You have to make decisions at that point. Do I want to eat this month, or do I need the medicine?
Are absolutely right.
Right.
And we've heard those stories about, like, we had in 2020 when we used to do food deliveries, there was a patient, a family that when we delivered the food to them, they said, like, today I was making a decision whether I should eat or whether I should put gas in my car, and you made my decision easy this day by giving us the food. So people do struggle
Incredible.
with this.
Yeah.
It's real.
Oh
Yeah.
Definitely. And like I said, for those of us who are lucky enough not to have to worry about this type of thing, it can come as a surprise that it's right here in our neighborhoods. It's all around us.
That's right.
So, having folks, like the Shifa Clinic who are doing the work on everybody's behalf, we want to thank you for doing.
Thank you. Another shout out to Lowcountry Food Bank.
Yes.
Yeah, they do such great work,
Yes.
and they represent such a large area.
Absolutely.
So
Absolutely.
think about all the people that they help. They really are.
Yeah, they're amazing. And, working with Lowcountry Food Bank for years, and their leadership, their team, their management, they truly stick to their mission. And I've had nothing but wonderful experience with the entire team of Lowcountry Food Banks. They are amazing.
And we partner with them as well, down in Allendale. We do food giveaways down there several times. We let them set up in our parking lot and deliver to that community as well.
That's right.
We participate in their fundraisers, the chef's table, or
Right.
every year we're proud supporters.
Absolutely. Yeah.
So I understand that you all have a new clinic location. Is that correct?
That's correct.
So
Correct.
So where are y'all located?
So we just recently moved in January to a very bright, beautiful, lovely location. It's at 668 Marina Drive. Okay. And it is very open, very light colored and beautiful, with windows and a great view for all our patients. And we are very proud that we are able to do that. And the reason for the move was because we were bursting through the seams. With our previous location, we wanted to make sure that whatever we do with efficiency, with love and care. And that also includes our team. So the team need the space. The team need a good space to work. And, that was also one of my motivating factors to have ICNA Relief sponsor this move and to buy the property for us. Because a good team is good work. Yeah.
Definitely.
We need to keep our team happy.
Oh, definitely.
Definitely.
And were y'all with the new location? I understand, it's larger. It probably has a little bit more capacity to serve folks. Or were there any other amenities that you were able to add on at the new location?
So we were able to have a more systematic approach towards efficiency in pharmacy as well. Our pharmacy is now better served. We have previously it was just one small closet. Now it's a whole pharmacy, and we have our vaccine refrigerators, everything in one place. So the person is not going from one end to the other to figure things out. So it is much more efficient. Same thing goes with food pantry. Now we have two separate doors for entrances for food pantry versus clinic. Previously, it was just one door. So you can imagine the entire traffic of the clinic through that one door.
Yeah.
So it has become very efficient for us.
So tell us a little bit about the dispensary and the types of medication you
Yes.
guys
So
offer.
we are accredited by South Carolina Board of Pharmacy, and this dispensary has run through 3 different organizations. One is Direct Relief and AmeriCares. They provide us with donated medications. And Dispensary of Hope is another new organization that we partnered recently. And there's a small subscription, annual subscription, but then they provide us medications on a yearly basis. So we have all anti-diabetics, antihypertensive, insulin, blood pressure, the contraceptives, hormone replacement, and even long-acting birth control pills like Nexpanons, IUD. We do all those as well. So the partnership in dispensary is through the Direct Relief, AmeriCares, Dispensary of Hope, DHEC providing us with vaccines, and Choose Well, another organization that provides us the funding to obtain long-acting contraceptives.
Wow.
Well, for those of you who just might be tuning in, we are visiting with Dr. Khan and Brandon Kinney of the Shifa Clinic, and we're learning about how they are providing high-quality medical care to those without insurance and doing their part to help prevent hunger here in the Lowcountry, which is an amazing mission. And, the clinic, from my understanding, is part of something that's called ICN Relief. And can you tell me a little bit about that and what it stands for?
Sure. ICNA Relief stands for Islamic Circle of North America. It's a national organization. It is a 501c. We have chapters in 36 different states, and ICNA Relief as a whole has 6 different programs. It has transitional home, disaster services, hunger prevention, and a back-to-school program, as well as the family services and health clinics. So these are the 6 programs. Disaster is our signature program, as well as the hunger prevention. We are also a voluntary, and we are one of the NOVADs, like the National Voluntary Organization Active in Disaster, and we have a seat in the board for FEMA. So this is, sorry, not for FEMA, for NVOD. The organization's mission, of course, is to have a charity goal for all Americans, to be a choice of charity for all. And this is a local chapter of the ICNA Relief, so one chapter of the national organization. And each chapter has different programs, and ours has only healthcare and hunger prevention. Okay. And through the last, we have served over 4.9 million people over the last decade.
So even though this is a faith-based organization, it's open to all?
Of course, yes. Absolutely. The faith makes it run the organization, what we do, but of course it's for everybody, services for all.
So is this the only location in South Carolina?
Yes, that's the only location in South Carolina.
And was there a particular need in this area, or
no? It was actually just me running after them and saying, "I want to start this clinic here." Yeah.
Well, tell us a little bit more about that. I mean, what makes you want to start a nonprofit? I mean,
yes, as I said, just honestly, it was just faith and accountability of the blessings that God has given us, the time, the talent He has given us. It's not just for us; it is for us to share and to. We will be asked about this. I gave you talent. I gave you time. I gave you this. What did you do about that? So wow. I wanted to stand in front of God and say, okay, I did this. This is what I used your blessings for. Yeah. So that was my only driving force, and it still is. And probably that's what makes me so energetic about it when I talk about it. It is very close to my heart, and I feel blessed that I'm able to be a part of this. So that's all it is.
I still just think that's a huge undertaking. I mean, I like to volunteer, share my time and talents, but don't think I'll be starting a
Yes, I know. And, actually, I could say ignorance is a bliss in some manners, because when I started, I did not know what I'm getting into, So then it just was a snowball effect.
Yeah, yes, but that snowball, I mean, such a blessing that, when you took the leap of faith you're surrounded by all these other physicians who are giving them their time. And
that's right.
It's just really, really grown.
Yes, absolutely. It's such a big blessing. Every day I walk into it, believe me, before I walk into my clinic, I always say a thankful prayer that I'm thankful that He gave me this blessing, that every day from the day 1 to now is my, even before I enter the clinic, I always thank Him.
Yeah.
Well, I mean, with an undertaking of this, magnitude, I'm sure, volunteerism is a big part of it. Say, Brandon, like the food pantry part, how many folks are involved in that aspect of it?
We have a lot of wonderful volunteers that contribute their time on a weekly basis, coming in, helping us prepare packages for our clients that come in, helping us organize the food pantry. We really wouldn't be able to do and run the pantry efficiently without them. So it's a huge part of our entire mission, and it's something that we would love to see more of. We would love to see more volunteers coming in. We love to have the smiling faces. We love to be able to have people giving back and seeing the real contribution that they're making to not just our food pantry itself, but to everybody out there that they're serving. So, if we have anybody that's looking to volunteer, please go to our website.
Okay,
and,
I was going to say.
Yeah, please go to our website.
Yeah, and the website is shifaclinics.com, SHIFA clinics.com.
That's right.
If you're looking to help out. What kind of commitment does it take to volunteer, say, at the food pantry?
Yeah, so the food pantry is open from 9 a.m. until 3 p.m. on a Monday through Friday basis. We really see a variety of commitments there. So we'll have some people come in, just for the brief time that they have. We had a volunteer yesterday come in saying, hey, I've got a meeting going on a little bit later today, but I'm just going to pop in and just help you all out for, a couple hours this morning. We have some that have stuck around for, almost an entire shift. We figure we might as well just put them on payroll at a certain point.
That's right.
So it's a very flexible opportunity, and it's just a really great, environment just to see them come through. And like I said, really see the difference that they're making in our community.
Wow. That's neat that somebody would be, I've got a little bit of time between meetings here. What can I do to help out? So that's cool.
Yeah,
we have an amazing community, and I really vouch for that in 2020 when everything was shut down. And at that time, a clinic was the only thing that was open, food pantry, for a certain amount of time. And that year, I saw the power of community. You won't believe how many people volunteered, and we were doing food deliveries, 100 food deliveries a day.
Wow.
And that could not have been possible without the volunteers. So 10 volunteers would come a day. They would take 10 families at a time and then deliver the food.
Right.
So the power of community, do not estimate it. How much your 1 hour can do, you would never imagine what you can give back to the community.
I was about to say, because I just, like I mentioned earlier, participated in a food pantry event. And it literally took us 20, maybe 30 minutes to pack over 120 boxes.
That's right.
And just in that little amount of time, you're able to impact that many families.
That's absolutely right.
So having that type of organization, is amazing to have in the community and provide that support to those folks who are in need. And for the food pantry, the qualifications, are they similar to the Shifa Clinic in terms of who can qualify for the food pantry?
No, for the food pantry, we follow USDA requirements. So they have to put an application which USDA requires us to do, and they can put whatever the income. There's no proof of income required. They can put the income that they feel that they have. And USDA is a little bit strict, but for the other food pantry, we don't have very strict requirements.
Okay.
Sure.
All right. And besides the food pantry, I understand that you all also host other events throughout the year. You mentioned, I think, back to school. We're moving into fall, and I know for us, that's a busy time of year. We've got a lot of festivals and back to school and all that kind of stuff. What kind of events do y'all have coming up this fall?
So we have 2 events coming up. One is our breast cancer awareness month. In October 14th, we're doing health fair as well as free mammograms. And then the second is a turkey giveaway. That's on November 11th. And we're going to be providing to at least 400 families free turkeys. Along with that will be hygiene kits, baby diapers, supplies, health fairs, health screenings as well.
Yeah. At Berkeley Electric, we all look forward to the various holidays, but, it's important to remember that some families may look at a holiday with some level of stress or dread even, because they may have a family that they're not able to provide to the level they'd like to. So it's wonderful to have organizations in the community.
Thank you. Yes, thank you. We are blessed. Yeah.
Well, over you said 10 years or so that you've been working to get to the Shifa Clinic to its current level, are there any sort of standout moments that you can recall, or any people who've sort of just left an impression with you over these times?
Yes, absolutely. Like over this 10 years, if I look back at it, what makes me the most proud is what as a community we have achieved and how far we have come together. The togetherness of the clinic, of the events, of the organization is what just makes my heart very happy. We are a very diverse organization, and we have the unity in diversity that we are able to pull out. That has been the standout feature of this organization. I would say more than anything is how we all can work together and how we all can contribute towards a bigger goal, to a bigger purpose. That's what I feel that is what my biggest achievement of the clinic is.
Well, and you mentioned diversity of your staff, but also of the people you serve.
Yes.
And you serve a large Spanish-speaking
Right.
population, but you have language services that's not a barrier for them.
That used to be a barrier before, but not anymore, thanks to Roper St. Francis. Again, third shout out. Yeah. Yes, Roper St. Francis has provided us with the translation machines, which help us with the live translator comes on, and we can do with 13 different languages.
Oh, my goodness. Yeah.
Well, is there anything else that we need to know about the Shifa Clinic? I mean, to me, it's sort of a unique organization in terms of like, there's a lot of faith-based organizations out there, but in terms of it coming from the Muslim, that to me is a unique
Yes.
Opportunity. Can you tell me a little bit more, about the philosophy behind that?
The philosophy is very simple. As in any other Christian, Jewish, Hindu organization, it will be the same. Service to God. That is the main thing. That's what that drives the entire organization. I've been with ICNA Relief for 11 years, and I personally can say the leadership team are very genuine, mission-oriented, ethical. And that's what has kept me in the organization as well for so long. And I've learned from them. I've been inspired from them. And this is like any other organization. It's the same philosophy about helping others, being kind to others, showing the best, the human behavior that we can, to be able to uplift ourselves more than others. It's all about you than others. Like I always say, kindness comes to you first before it goes out to others. How much of a difference it makes in your lives, the blessings that come to you. Not necessarily, it might not come in form of money. It may come in form of your children, your happiness, your peace, your contentment in the house. So we do it for ourselves. Before we uplift others, you uplifting yourself. So that is the base. If we all understand that, I think it would be so much easier for us to do things, right? Yeah.
Well, and it's so wonderful how unifying the Shifa Clinic is for the community. Just everyday volunteers to lots of big businesses that are participating. You've listed off a bunch of the big name hospitals, Amazon. They've taken over the world, I think. But but it's wonderful that the clinic is an outlet for these big companies to give back and help.
We're just a platform. We're just a platform for all of us to come together, and that's what our strength is.
Now, I mean, I know that you said you've got a new facility and you've got some new services that are available. And you're seeing at the old location you were seeing around 3,000 or so folks. And what's the capacity of the new?
So we are hoping to go 10% more. Every year, actually, we have 25% increase. Average. Even when we were in the old facility, that was like 25% average annual growth rate. And I think this year it could be even higher.
Oh my goodness.
Yeah.
I thought we were growing fast, Mike. The co-op is part of the growth in the Lowcountry, particularly Berkeley County, and we've been growing by 5 to 7% for the last decade, but not 25.
No, not 25%.
honestly, we have all the statistics, and it's going like boom, 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 very fast, and very high growth rate. And that's the reason we had to move to a new facility, even to contain the existing growth, not even to expand.
Yeah, I mean, we like you said, mentioned, here at the co-op, we sort of ran into the same problem.
Yes.
We sort of were busting at the seams. We've got around 7,000 new folks coming on. we had gone, I think, our original facility was somewhere, we started out with probably 80 or 90 employees. We were up to about 300 employees. We were in 5 or 6 different locations. And so we're blessed with having this new facility here in our nice new recording studio.
Love it.
We're able to, invite people in and really, hopefully showcase some of the things that are going on in our communities. And highlight and lift up those organizations that are providing help to our members and everybody else who lives here and making the Lowcountry just a little bit of a better place.
Thank you.
Yeah.
Thank you. Yes.
So if you want to help, again, the website is shifaclinics.com, SHIFA clinics with an S.com. So lots of great ways to give back.
Well, folks, thank you for tuning in to Power Talk. That's going to do it for this edition. So this is the official broadcast of your electric cooperative, and you can catch up on past episodes on streaming platforms like Spotify, Apple, and iHeartRadio, and to get a behind-the-scenes look on Berkeley Electric's YouTube channel. So for next time, this is not Spotify, excuse me. We're going to be editing that part out, folks. So until next time, this is Power Talk signing off.